My name is Henry Striplet. I am a third year internal medicine resident at Mount Sinai Hospital. I also practice at the Institute for Family Health where I see patients. Today, I'm going to be speaking about allergic respiratory diseases and allergies as a whole. The objectives for our conversation today are to talk about the basics around allergies, explain how allergies can contribute to breathing difficulties, and then identify ways that we can protect ourselves from the ways essentially that allergies make us breathe and whatnot. So the human respiratory system consists of everything from the nose down to the lungs. We generally think about it in two different sections, the upper respiratory tract and the lower respiratory tract. Our first part of our conversation today is going to focus on the upper respiratory tract, and then we'll kind of discuss the lower respiratory tract and how it all connects. So first, allergic rhinitis. Allergic rhinitis is essentially inflammation or swelling. Inflammation is another word for swelling of the nose opening or nasal canal. Oftentimes, symptoms involve sneezing, mucus production, watery red eyes, and often postnasal drip, which is that sensation you feel at the back of your throat when the mucus sometimes comes down. This is oftentimes caused by dust, animal sheddings, mold, and pollen. Oftentimes, pollen is a key trigger, and that's essentially when we talk about seasonal allergies or when people mention that they're not feeling well because of the allergies and the air outside, they're essentially speaking of how pollen causes them to have allergic rhinitis and have these symptoms of inflammation and swelling. Risk factors for allergic rhinitis involve kind of family history. Oftentimes, individuals who experience allergies, their families deal with something very similar. It's often exposure to allergens also cause that. So smoke, inhalation, dust, mold, rat droppings. A lot of those are oftentimes very big risk factors for developing or experiencing allergic rhinitis or an inflammation. Oftentimes, to kind of figure out if you have this, it's important to speak to your doctor if you're having some of these symptoms. What I would recommend is if you think you might have something similar to this, just jot down when you're having symptoms, jot down kind of where and when, what time of the day, what you might have been around, and kind of bring that information to your doctor. And you can have a conversation with your doctor around if these potentially are your symptoms and what you might be experiencing. In terms of treatment, oftentimes for most people, they deal with it very periodically, exposure to certain things. And so we often recommend patients take over-the-counter antihistamines. Very common ones are Zyrtec or Legra. Oftentimes as well, we recommend intranasal sprays. But the biggest thing for allergic rhinitis, seasonal allergies, is just to avoid the potential triggers and kind of get whatever is causing your symptoms. So if it's dust, trying to keep your surfaces clean. If you have pets, maybe keeping your pets in specific rooms or keeping them off the bed. Also, if you have pets and potentially getting an air filter. Oftentimes, if you think you have a lot of these symptoms, you have seasonal allergies, we recommend potentially, if you don't already have pets, to maybe hold off until kind of getting those things in line. Usually, allergies kind of follow what we call bimodal distribution. And so oftentimes, we'll get them as children
Hmm.
and kind of have symptoms. And oftentimes, usually children will experience them and then they'll get better. And then sometimes people will develop them later in life around, and the later portion of life after 40. There's another kind of up and down where people will then start to experience those symptoms. Sometimes we're having symptoms or allergies and not really always realizing them. It's something we call kind of like subclinical kind of symptomatology. And so you just don't fully recognize why you feel the way you do. You might kind of like feel crummy and not realize it. And then kind of later in life, you start to realize like, oh, like when I get around trees at this time of the year, I start to feel this way and whatnot. So definitely allergies can kind of happen at any point throughout the lifespan. They just sometimes most oftenly happen when we're children and kind of usually around the age around 40, there's another kind of spike. Essentially, what allergies are things outside our body that are impacting or infecting our immune system. And our immune system is constantly evolving and changing. And so as we get older, our immune system is changing and what impacts it and what triggers it is changing. And so again, it's kind of random, but it's important, that is the case. One, speak to your provider, your primary care provider. And then from there, your primary provider can determine if you need to potentially be connected to like an ear and nose specialist, so an ENT doctor, who are oftentimes the people who deal with what I mentioned, the upper respiratory tract. There's that kind of make sure like the allergies and the polyps and all that I spoke about are kind of taken care of. And then there are specific doctors called allergists and immunologists who kind of help to do testing on what things might be our triggers and how to potentially treat those potential triggers and whatnot. So there are specialists beyond kind of your primary care doctor that could potentially help you. But I would say start with your primary care doctor because they can lead you in the
Hmm.
proper direction and get you the help that you need. Right now is kind of one of these major periods of peaking we have. So
Hmm.
oftentimes late April is when you kind of get the start of the season. And then usually that goes into the beginning portion of the summer is like a peak season for a lot of people. And then oftentimes when fall is coming around, so the end of summer, like or beginning of fall, so in September, October is oftentimes when a lot of people get another wave. So what ends up happening is there's like two kind of major waves that happen throughout the year. It's usually the beginning of spring into like summer and then the beginning of fall. Everyone is unique, and so sometimes people will have their symptoms at different times, but usually that's kind of the major time periods. So very much connected to seasonal allergies and allergic rhinitis is rhinosinusitis. So now we're kind of essentially moving up and talking about the sinuses, which are an area of the head that connect to the nasal passages. And so rhinosinusitis is essentially inflammation and swelling of both the nasal openings, canals, and the sinuses above them and around your eyes. Very similar symptoms of sneezing, mucus production. But then now you have an associated headache and fevers that sometimes come in as well. Oftentimes patients will describe it as pressure in this portion of their face that like they feel like something is just like pushing down on them. Rhinosinusitis kind of breaks down into two parts: acute, so symptoms that occur for 2 to 4 weeks, and symptoms last longer than that, and those we consider chronic. In terms of acute rhinosinusitis, oftentimes it's associated with infections and viral infections. So sometimes you'll hear patients or people speak about head colds or kind of just uncomfortable sinus kind of experiences, sinus infections. And so that's essentially what they're talking about is just an acute rhinosinusitis or acute infection or inflammation of this area. However, sometimes patients will have these symptoms chronically and for, months to years have this sensation of pressure on their face and have, difficulty fully breathing, congestion, mucus production. There are many things that can kind of cause these symptoms, but oftentimes if you do have allergies, you sometimes have what we call polyps, which are kind of overgrowths of the tissues and areas in the nasal passage and kind of cause more likely to have more inflammation, more swelling, and not have clear opening passages and kind of catch a lot of those allergens that also come in. Because allergens, we inhale them and oftentimes they kind of go through our passage and get cleared, but sometimes they get stuck by like portions of our tissue and portions of these nasal passages or polyp, and that's kind of what makes our symptoms worse. So that was the upper respiratory tract. And like I said, it's all kind of one system, the respiratory system, but there's an upper and a lower. So that was the upper. Now I want to talk a little bit about the lower. So from the neck down. Essentially, asthma is swelling, inflammation, and mucus in the lungs that make it difficult to breathe appropriately. It's the sister disease to a disease we've potentially heard of before called COPD. And oftentimes it comes with the symptoms of shortness of breath, chest tightness, wheezing. Oftentimes is brought on by something that leads to what we call an asthma exacerbation or an asthma attack. So it's a condition that you may have consistently that you may not always experience, but something then will cause you to have an attack of it. The most common type of asthma is allergic asthma. And so oftentimes individuals will have symptoms initially as children. It's often brought on by pollen, inhalation of smoke, and we often treat it well with medication inhalers. But for most people, even if medication can help control allergic asthma, the medication can't overcome a lot of our triggers. And so even if you're on medication that you're managing decently well, if you get exposed to whatever your trigger is, and for some people it's cold, but in terms of the allergic asthma space, for some people it's dust or mold, the medication alone is going to be very difficult to kind of overcome that trigger. And so it's going to be very important to rely on and lean on prevention and preventing, contact with that trigger. So eczema is a skin condition that's essentially characterized by like very dry skin, more so than your typical level of dryness. Oftentimes there's like flaking that occurs at the skin point and whatnot. And it oftentimes is kind of resistant to our typical measures of handling dry skin, of just kind of applications of lotion. Oftentimes very severe eczema, you potentially need steroid creams or something like that to treat. But there's a full spectrum, like allergies, like asthma, there's like a full spectrum. And so very kind of, mild eczema can do well with lotions and kind of things like petroleum jelly, so Vaseline, or just like kind of like providing like strong barrier protection and whatnot. So that's kind of what eczema is on a basic level. There is, unclear exactly why, but there's a strong connection between the three. And oftentimes they'll happen at different points in life, sometimes all together, obviously, but sometimes individuals will experience allergies early in their lives and kind of then develop asthma. And then later in life, will start experiencing eczema. So it's not uncommon common for people to kind of developing them at different points. And just know that it's very common for most people to have two of the three or all three. Another connected condition is called reactive airway disease. It's a lung condition very similar to asthma with the wheezing, cough, shortness of breath, but is often in patients who don't have a diagnosis of asthma. What brings it on is an infection. And then when individuals have that, having other factors on top of it, like an allergen or having allergies, can make your reactive airway worse. Oftentimes, we'll see patients with reactive airway disease after having a respiratory illness. So patients will sometimes come in with the flu. They will then afterwards have kind of some difficulties breathing afterwards and have reactive airway disease even after their flu is kind of passed and they feel better from that. Their breathing maybe not be fully back to where it was before and have some component of reactive airway disease. And then an allergen on top of that will make it even more difficult and uncomfortable to breathe. The big thing in this space is prevention again. And so trying to get your respiratory vaccines, your flu, your annual flu, COVID, your pneumonia, which is, now a one-time vaccine, and your RSV, which is a newer vaccine, to make it more likely that if you were to get an infection, it's more likely to be a mild infection than anything else. Oftentimes, when we deal with respiratory infections, we can then deal with what's called a post-infectious cough. And oftentimes, we'll deal with that from anywhere from 2 to 12 weeks. It's one of those things that I don't always love telling patients because it's one of those things that we often can't do very much about. So it's an unfortunate kind of thing that we deal with where we'll have a chronic cough for a little bit of a while. Just know that that's very common. Oftentimes, what I recommend is just trying to keep yourself well hydrated during those periods. I often recommend tea with honey. Honey oftentimes has like a soothing effect. Though of note, I would not recommend giving honey to young children, and I would talk to your pediatrician before considering giving honey to children. But for adults, tea with honey is what I recommend. In terms of long COVID, in terms of some of the respiratory conditions with that, I think, usually if you're still having kind of respiratory symptoms 1, 2, 3 months, but really kind of close to the 3-month period after COVID, seek kind of medical care, talk to your primary care providers and see if there might be a pulmonologist they might want to connect you with or someone at a long COVID institute that they might want to connect you with. There are many kind of conditions that can potentially can come after COVID, and reactive airway disease is usually the shorter end of the stick. So if you're having kind of symptoms after that, then potentially there might be something else involved and it might be worth potentially investigating a little bit more. And so in the big picture of this kind of conversation, like I mentioned, there's an upper and lower respiratory system, but it's all one system. Breathing difficulties from allergies can start in the upper respiratory symptoms and cause a lot of the congestion, head tightness that we were mentioning before. And then that could then lead to difficulties in your lower respiratory tract in terms of just feeling short of breath and kind of triggering your asthma if you were to have asthma. Also, difficulties in the lower respiratory system. So an infection from the flu or something along those lines, you can start having difficulties in the lower respiratory system first, and then your allergies or other elements from the upper can make that worse as well. So a full component of this whole system working kind of synergistically to make it more difficult to breathe. Oftentimes, something that isn't always talked about is individuals with asthma also deal with allergies and eczema. It's a little triad that all comes together. And so if you have asthma, you potentially have allergies. You may not know it or just haven't experienced it yet, and vice versa. And if you are chronically having some of these difficulties breathing that I've mentioned already, it's important to speak to your doctor regarding if you might have allergies, asthma, or a related condition, and if ways to protect yourself and be mindful. Also kind of connected to this bigger picture is how can you protect yourself if you were to have potentially asthma, allergies, or whatnot. First, again, is to talk to your doctor if you're having these symptoms regularly and kind of jot down when and how you're having these symptoms. For you can, in conversations with your provider, talk and identify triggers. One thing that could be helpful if you know you have a family history or you might think you might have a family history to kind of pursue that information and provide that to your provider. The next major thing is attempt to keep kind of surfaces regularly cleaned. So sofas, carpets, bedding are oftentimes ways or spaces or places where allergens kind of really, get in there and live and kind of stay. And so trying to kind of keep those areas clean, regularly washing bedding sheets and whatnot, avoiding pet sheddings and kind of, if you do have a pet, kind of keeping whatever comes off them cleaned often. Avoiding chemicals in the air is a big one. So if you smoke, potentially trying to cut back on that habit. If you're around a lot of secondhand smoke, trying to kind of move away from that space if possible. Also, cleaning sprays is something that often is isn't discussed enough. Oftentimes we'll use products to clean our bathrooms and our showers, but oftentimes if you are going to be using sprays, try if there's a window in the space to keep it open. Try not to stay in the rooms for that long. Maybe you're cleaning for a little bit, get up, walk around, and come back to kind of give your respiratory system a little bit of a break, and trying not to use an excessive amount of cleaning products. And then the last major thing is to pursue seasonal vaccines if you were to get an infection, to prevent it from potentially being a more severe infection. It's always better to prevent something than have to treat it. And a lot of these things that we're talking about, COVID, flu, RSV, these are viruses. And so while we have some medication to help, we don't have the greatest of medications, because viruses hide inside the cells in our body, and our body has to kind of fight those bacterial infections. So some of our pneumonias, our bacterial pneumonias, we have antibiotics that we can give. There's good data, and those are good medications for bacterial infections, but viruses are very different. And so the biggest thing you can do is to prevent. And we have very great vaccines out, and so it makes sense to try to prevent because the medications we have to treat are not as great.